Hello and welcome to another edition of Happenings.
It really is all about and bringing the community to the school.
In the schools, developing relationships with students, with parents.
No, we just taped a show on that.
Hello and welcome to another edition of Happenings in the Dearborn Public Schools. I'm David Mustonen, Communications Director for the Dearborn Public Schools. And joining me are people reading the paper. Well, I'm glad to see that all of you are reading The First Bell. Are you enjoying it, Dr. Maleyko?
Yes, absolutely. I was reading, what goes into, very interesting on what goes into calling a snow day. Very informative. I had a good learning from this.
Experience.
Yeah, a good experience. I really need to be informed. It kind of goes along, too, with my, we really don't have to worry about it, though.
Yes.
Because actually my New Year's resolution was I'm not going to cancel school for snow, wind, or anything else for that matter, including conditions like meteorite.
No meteorite. Okay.
So I don't even know. Maybe next time we'll have to change that.
We'll have to change this. Update the article a little bit. You're not going to do any more snow days.
Well,
or meteorite days.
Hopefully I keep
anything.
it, right? Hopefully, people never break their resolutions,
That's right? No,
right?
never.
Yeah. So no, very good, very well done. I wonder who published this.
Well, funny you should ask. And this publication, The First Bell, is done by our communications office. It is a brand new publication for our district and started in January. 2 issues are out, the December and January, and the February edition will be coming out shortly as well. So you can look for this. Where can I find The First Bell? Well, it's a little tricky. It will be delivered to each and every home in the city of Dearborn and Dearborn Heights, the section of Dearborn Heights that's in our district, about 35,000 homes. You will get this in your mail. Look for it in the coupons section. So every week you kind of get that big pack of coupons that have great coupons, believe me, let me tell you, deals all over the place. But even more important, if you kind of open up and look through there, you should find The First Bell right in that section. It should stand out. It's a little bit bigger than a lot of the other publications that are included in that. So we hope that everyone takes a look at The First Bell. And here's the great thing about it. This is called cross-promotion. See, this is cross-promotion. See, the Happening Show, we're on the Happening Show, the Superintendent's Happening Show, and we're talking about The First Bell. And in the February edition of The First Bell, we talk about the Happening Show in The First Bell. So see, that's cross-promotion. It's just like it's like when you're watching the football game and they talk about the new show that's coming up later on that night. That's exactly what we're doing
hand in
here.
hand.
A nice connection. You know what? I had another connection too when I was in your office and I saw all those papers and all those cutouts all around. Now I know what you were doing. You were cutting out coupons.
That's right. You got to save a penny wherever you can. So, anyway, enough about The First Bell. But yes, please take a look in your mailbox for this because it comes out monthly. It's a great, full of information about the district. It has these cool little QR codes you can scan with your phone, and it'll jump you right to a website that has additional information, more photos, additional videos, in-depth coverage. So we want to make sure that everyone's checking out The First Bell. But today, we are here to check out a program going on in our district, actually a partnership, one of the many that we have in our district. And joining us is Ms. Danene Charles, Dr. Rola Bazzi-Gates, and so Glenn, let's get into this.
Well, drug prevention. So we know there's an epidemic nationwide. I've been to different sessions with the FBI, with other things on the opioid epidemic, and we see it published all over. It's all over the nation. It's something even the president has spoken about. So we decided that we wanted to partner with the city, with the chief, with different organizations. It came up last year at our city relations. We've done things in the district, but we haven't necessarily unveiled a full program across the district like what we're doing right now. So I credit Ms. Charles and Dr. Rola Bazzi-Gates. So I'm going to kind of let them, I'll give it to them to, explain this partnership that's been in the works for a while. It started, last year the conversation started with Chief Haddad. In fact, we just had a meeting with Chief Haddad yesterday, one of his sergeants, where we're trying to secure some grant funding. So I'll turn it over to both of you to kind of explain and go over, what is the model and the partners that we are working with.
Sure. I'll go first.
Go first.
Okay. One of the things I wanted to say, though, Dr. Maleyko, you said it happened last year we started this, and I think that's so important to point out because before President Trump declared that it was a national epidemic in terms of opioids, we had already been working on this plan. So the foresight of our district to know that there was an issue and that we wanted to be proactive, not because that something significantly happened in the district, but because we knew that something needed to be done, and we began that work. So Dr. Maleyko and the board charged us with coming together as a team to come up with some type of district-wide systematic way to approach it in terms of educating our students. So we decided that one organization couldn't do it alone. And as you said, Access had already been working with us, and different organizations all along have been working with us. But to really bring all of those together and unify the community is what we needed for 21,000 students. We have a large district, so we needed the power of the partnership, which is what David coined on our first release about the program. So we have Access, we have LAHC, along with C-Assist and SAFE, helping us educate our students.
Well, like you said, it's 21,000 students. It's a big topic, and it's has lots of variables, and we're not talking to the same audience, right?
Sure.
Dr. Gates, we're probably a very different message to elementary kids than to high school kids.
I'm very excited and happy that we have these programs that are going to be delivered by professionals in our schools, and it's going to be from students from 3rd grade to 5th grade, elementary, and also middle school and high school. So the professional will come to the classroom, will deliver the messages. Of course, when we talk about elementary, we're talking about students. The subject will be discussed with them according to their, of course, level of understanding and appropriate language using with them and using visuals to educate them. How can we have healthy mind, healthy brain, healthy body? And what's the effect of drugs on us? If we take drugs, what's going to happen? So a lot of education and knowledge to students, showing them videos, something appropriate that they understand, and they, work with their parents, talk to their parents about it. And also another part of this is parent education. We're going to have parent education in the evening and present to parents about drugs and effects and mental health and how it's affect our students in the schools and at home.
Well, and I think Chief Haddad had talked about that as well, is like getting information to parents on signs to look for. But I know that, what you just said too is it's the families that get impacted, and it may not even be our student. It could be someone in their household. It could be an adult in the household. It could be a sibling. It could be individuals that have this, this addiction, and how can they get help, and what are the signs? And I know that that's one of the things we said in the meeting the other day, was that we want to get some literature out there and really promote it and promote, awareness. So like we're also, when we're saying, we monitor these incidences, and we're not saying this never happens in our district, because we're not naive to that, but from the times that it does happen, the district's on top of it. I have the data. It's not like it's a widespread data of things in the school, but we also know that, again, we're not naive, that we do know that things happen, and if it happens in the community, it impacts the school and vice versa. Having said that, we have monitoring protocols, of course, with administration and things that we're doing in the school. So rather than saying, oh no, and and just enforcing it, because we know that that's not going to solve the problem, the both of you have kind of led the charge with this model that we're going to be proactive from an education standpoint.
Yes, we are, as educators. I think it's very, very important and critical to educate students, our community, the parents at home, what to do, what to say with their kids, and how to seek help. If there's a problem, you're right, Dr. Maleyko. If there's any issue in the house, the parent need to know how to seek help, how to come and trust us, come to the schools, for example, talk to professionals and ask for help, and we direct them what to do. We can save somebody's life. I really, really believe in what we're doing is the right thing to do, and I'm very excited that we're working together, collaboration with all the community organizations to work together, because I believe hand in hand we can make a difference.
And I think we're talking about substance abuse as a whole. So when you look at
Yes.
whether it be prescription drugs to other forms of drug, marijuana, alcohol. I mean, we had a tragedy last year. Didn't occur in the school, but it was part of our school family that we had a passing of a student outside, over spring break. And so it's something we want to bring awareness to the students and families of things that need to happen so that we can prevent such a tragedy that hit our entire school community.
Definitely. And we heard yesterday Chief Haddad when he was talking to us about number one killer right now. We heard about drugs overdose. Honestly, this is what's going on, in the community. So we need to prepare and educate our youth to be ready and to stay away from any, bad choice.
Well, I think too, I think a lot of us, we remember the DARE program that was in our schools many years ago. I mean, very good program, very useful. But of course, like many things, funding comes and goes, and that was a program that was funded outside of the schools, and that program kind of went away. And I think there was a void there, and I think this partnership helps to fill that void. And how does that work? What partners are they splitting up by grade level, or are certain organizations taking certain sections of the city? How's that partnership divided up?
That's exactly what's happening. We have a feeder track, but it didn't work out perfectly that we could give the equal amount to each of those organizations. So what we did is really looked at the different schools. We looked at the expertise, the signature, the branding of those organizations, and we matched them accordingly. So if we have, let's say for instance, the Michael Berry campus, C-Assist will assist them 100%. They have that expertise. There was a need in terms of additional social work, so they're going to be there specifically helping that particular campus, along with the Henry Ford Early College. So it's just strategic in terms of us making those decisions. It wasn't just, okay, we're going to pick someone to go here and pick someone to go there. It was very well thought out, because we wanted to make sure that all of the students got what they needed, but also that those organizations in their expertise could really be of value at those different schools. And then we took it a step further to say, not only do we want to talk about substance abuse and just saying no to drugs, we know that's not enough, but we really have to think about that positive messaging and giving students the verbiage to say no without just saying no, but understanding why I need to say no so I can have a healthy body, healthy body,
Healthy body, healthy mind.
So, and that's important, because that's not enough just saying no. We know that our students, they need to know more. They need to see, how does an unhealthy mind look? And we can show them, and we have professionals in these organizations that can really paint that picture for them so that they really get it. And we thought that that was very crucial.
Well, one of the organizations hosted us at the Islamic Institute of Knowledge, and it was part of, not just because of the drug prevention, but that was the main presentation. But part of it is that we're holding some of our administrative meetings in the community. We're outreaching. Last year we went to the Arab American Museum. I know we're going to Henry Ford College, so it's a kind of a combination of reasons. But we had a real positive meeting over there, and they came out, C-Assist, and they provided presentation and training to all of our staff on drug prevention. So it was kind of hit multiple purposes. But again, that's a way to get out in the community, and they're saying, look, they presented the facts. They showed the data of what's going on, not only across the nation, but in Dearborn, where the problem is occurring in Dearborn. So we've got to accept that there's not only a problem nationwide, but it is local.
Here.
And so we can, we don't want to ignore it. We want to address those issues. I mean, they brought up things about, the smoking and other things like the hookah, and how that is also a health an issue with.
Definitely.
so,
No, the meeting was very meaningful, honestly, in the right place, and they were very hospitality. They took care of us, and they presented to us, and a wonderful partner with us. So I'm happy and excited that we work together.
And I think the other thing to bring up also is that those power partnerships are premier, I think, because we have LAHC, which is leading, advancing, and helping communities. And then we have Access, of course. And I think that all of them working together, assist, the passion is equal. They're very excited about joining with us. They have ideas. They're giving us more ideas than we can even handle. So that's powerful because that shows their investment and commitment to the students of Dearborn and the families. And we want that type of energy and excitement so that we can move forward and really, as Dr. Bazzi said, save lives. Because at the end of the day, that's what it's all about. Students can't think if they're smoking marijuana or if their parents maybe have issues. They really can't perform academically if those things aren't addressed. So it's a great work, and we're really excited about it.
Absolutely. Well, thank you, both of you. And
You're welcome.
I know part of this, too, we're planning for a big day in April, Care to the Core, where we're going to have not only drug prevention, but positive bullying prevention, other things that are going on in a positive aspect that we want to make it a district-wide day. And so this will be aligned with that. And so we appreciate the work they did, the partners that you all mentioned.
You're welcome.
We're really grateful. So.
Yeah, well, once again, it just goes to show you that the role of schools is a lot deeper than just, reading, writing, and arithmetic. Our role is much bigger in the lives of students, but we can't do that alone. We just can't. We don't have those resources, and it really does require us to partner with the community and the community to partner with us.
Sure.
Because, as we said, and I think you said that, Dr. Maleyko, is that if something, it may not be a problem in the schools, but if it's a problem in the community, then it is a problem in the schools. It goes both ways.
I just want to mention also that we also bring in suicide education and prevention. This is another thing that we're going to do in high schools. Bring the speakers also and talk to students and parents and bring awareness. Because I know they go hand in hand. When we talk about drug abuse or mental health issue or suicide, all these issues, they go hand in hand. So we have to address everything, all of them.
Yeah, that's great. That's
Yeah.
important.
Thank you.
So, thank you for joining us.
Thank you very much.
Thank you.
Thank you for having us. Yeah.
Another great episode. Approaching the big 4-0, I think. We're talking
Yes.
about the number
Yes.
of episodes,
Yes.
not our age. 'Cause I'm way beyond it. He's not even close. I'm way beyond
No,
it.
my wife reminded me I'm 4 or 5 coming up soon.
Oh, So another episode wrapped up, and we have plenty more. Remember, look for us on YouTube, look for us on the District Cable Channel, look for us on Dr. Maleyko's blog as well. There is a lot going on in the Dearborn Public Schools, and we're here to talk about it on the Happenings Show, the show that talks all about the great things going on right here in the Dearborn Public Schools.